Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. Today, I am here with Miss Joan McLaughlin. Very excited to have Joan here today. And if you're new to our podcast, welcome. And I hope that you have an opportunity to hear Joan's stories today. And this story can empower you to become the CEO of your own health. Joan, we have a good story to share with our audience.
Yes.
One of the things that I love about having this conversation with my patients and the women that we serve is that we all have our journeys, but there are so many resemblance in the journey. No, so we are more alike than not. Although sometimes we think that we're so much different than the woman that is sitting next to us at the cafeteria, at church, at the mall. We are so much alike, and we have to start making those connections. So your story hopefully will help other women to understand that can be them, and that's what you're here today.
Yeah.
So
Yeah.
I actually invited you here because you have one of the most typical symptoms for heart disease in women that is not recognized by many women. And I want you to start sharing with them, you know, how did you end up with me and what was that symptom that you were experiencing, like we were discussing before? Go ahead.
Well, I ended up with you because so many people on my father's side of the family died of heart disease. My father lived to be 92. He lived the longest and always put stuff in a frying pan and had a terrible diet.
Mm-hmm.
But he still
Had
smoked.
good genes.
He has good genes, I guess. Yeah, I guess I'm lucky in that I got those good genes.
So when you decided to come and see me, it was more about I have family history. It was more to try to understand and know about your heart. You didn't know that there was a problem.
Well, my husband was seeing you, and I went with him because he had quadruple bypass. And he was like us women. He didn't say anything for 6 months.
Mm-hmm.
And
So
finally he did.
So coming in with him motivated you
Yeah.
to come and see us, or did I invite you to come and see us?
No, coming with him did motivate me. And then when I met you, that helped.
Okay. I'm glad. I'm going to take that as I felt comfortable that I can come and see you and that you can serve me. Yes?
I had filled out all the paperwork.
So when you come and we have our first conversation, I'm glad that you actually said I came to you mostly because I wanted to get checked and not because you knew there was something wrong. Because now we're going to say, but there was something wrong and you just didn't know that there was something wrong. Yes?
Right.
And this is actually so amazing because when I said, is it true that the woman doesn't experience symptoms or is it that they don't recognize their symptoms? No. So when you came to see me, you shared with me in that first visit that for 1.5 years, you were having discomfort between your shoulder blades. But the only reason that you actually shared that with me is because I asked you. Mm-hmm. So you didn't facilitate that information to me. Every time I have an encounter with a woman, I will ask questions about symptoms. But I don't ask about chest pain, although I can ask about chest pain. I'm going to go over those what I call quote-unquote atypical symptoms that I don't call it atypical symptoms, typical for a woman. And I ask you, do you have any symptoms of shortness of breath with physical activity? Do you get winded quickly? Do you have pressure in your chest, your neck, your jaw? Do you have pain or pressure in between your shoulder blades? And you went, yes.
Yeah.
And then I said, for how long you been having that? And you said, for
A 1.5 years.
For about 1.5 years.
Especially when I walked through the parking lot to get to your office, I was feeling it between my shoulder blades.
And did you mention that to any provider prior to saying that to me when I asked you?
No, because I thought it was just related to the polymyalgia that I had had. So I diagnosed it myself and said that's what it was.
Okay. So for a year and a half, and you're like, okay, so here my polymyalgia act up when I'm walking in the parking lot to go and see Dr. Alvarez. Yes. So important message for the woman is if you don't know what symptoms to look for, you might be ignoring your symptoms for too long before you end up in the hospital with a heart attack. Unless you're lucky or blessed enough to find somebody that is going to ask you. So don't expect that they're going to ask you. You need to know. So which is the idea of doing this podcast, the idea of the documentary, the idea of the book. In the book, I actually talk about the quote unquote atypical symptoms for women. Because if we don't recognize them, we don't going to seek medical attention. Like if you knew before you established with me or a year and a half ago that discomfort between the shoulder blades is actually a sign of heart problem, or it could be a sign of a heart problem, then you wouldn't be walking around for a year and a half with that. No, you have got that.
I
got
probably would have said something.
Yes. Yeah. So when we evaluated you, whenever you acknowledged that you were having the problem, I have you do some tests. So we ran a battery of tests, and then the test came back normal. We did a stress test, we did an echocardiogram, and everything came back normal. No concern for blockages, no? But you were still having the symptoms.
Yeah.
So at that point, I suggested that we do a coronary angiogram because I was worried that this is a coronary problem, so that your heart was not receiving the blood flow because, as you shared with me, your symptoms were worse as I tried to do stuff. Yeah, so it's there, but like walking from the parking lot to your office, it get worse. If I'm doing stuff around the house, it get worse. And so we started you on treatment. So we did treatment for your heart, and as we started incorporating the therapy that is to relax those arteries in the heart, symptoms got better or not?
Yeah, well, I'm very rarely having what they call PVCs, which is perpendicular ventricular something or other.
Premature ventricular contractions.
Yeah, I had been in the hospital even for that, because I was, a lot of it I think was medication related, that I was getting a lot of symptoms of that. Mm-hmm. Now I sort of don't pay attention on my blood pressure monitor when it comes up.
Are they better?
Because it's not consistent. Yeah, it's much better.
The PVCs are better.
Yeah, because you changed my medicine.
Yeah. So PVCs, for the audience, you already tried to say it. So the short version is PVCs, premature ventricular contractions, are extra beats that are coming from the lower chamber of the heart. And normally when we see PVCs, it's an irritability. It means that the heart is complaining. It's like a dog going, when they need to go out or they need something from you. So, or scratching you when they need something from you. So the heart is actually irritated. So sometimes that's the only thing that we see is PVCs. Mm-hmm. So when we started treating you for your angina, because what you were experiencing was angina, the pain in between your shoulder blades, the tightness in between your shoulder blades. The PVC started getting better as we were trying to adjust your therapy for both of them. So the heart started receiving the blood flow properly. And as the heart started receiving the blood flow properly, your symptoms started getting better, your PVC started to get better. Yeah. So I think that for the audience, the importance of listening to this part of the story, because we have something else to share with them, is actually more about, first know what are the symptoms of heart disease in women? And we have repeated that so many times in here. If you want more reference, you can actually, these days you can find this in WebMD, in many other places, but you can also have the reference, my book, Hills versus Ties. Yeah. Know what symptoms are, know what your risk factors are, and of course, if you're having symptoms, get checked. And make sure that you get an answer to what you're having. Like, don't let anybody tell you that the pain in between your shoulder blades is because you're stressed out or because you have polymyalgia. Because somebody could have told you that. Of course, in your case, it was not. But what if? And then you're like, you got to know that, okay, perhaps it is, but how do we know it's not my heart? I read or I heard that a heart problem can present with back pain. So the idea is giving the tool to these women that are listening to your story that please, 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 please don't ignore those symptoms and try to attribute them.
I have people in my family that do this. They ignore it. You know, I have one cousin that dropped dead on my father's side.
It will end up costing them their lives.
And she was an operating room nurse.
And sometimes what happens, John, is like people are afraid of finding out that something is wrong with the heart. So they try to attribute. It's easier to say it's just my polymyalgia rheumatica. No?
Yeah.
Because then that doesn't scare you. But if you said, oh my God, can this be my heart? Then that scares you, no? But I want with this type of projects that we're doing to take away that fear. Because I want people to start thinking the sooner you take care of this, the better the outcome. No,
Yeah.
It's like ignoring a noise or a light on your vehicle, on the dash, that is telling you something is not right. And then you're like, I'm afraid that this is going to be the engine, but I don't want to think about it. Yeah,
Right,
it's like eventually you're going to end up left stranded and it might be irreparable and you're going to need to get another car. So for us, it's like listen to those signs and do something about it. I know that it's scary, but if you do something ahead of time, early, in your case, you try to do something early and you did, not knowing that you were having symptoms. But if you do it early, then you also have an opportunity to have a better outcome. Yeah, definitely. Okay,
Definitely.
So before we close this segment of the podcast, I want to also for you to share with the audience. I know that you have a good story where you became the advocate of your own health and became the CEO and got in charge and started giving orders to people. Share that with the audience.
I didn't do that.
Took care of you. Go.
Well, I had my knee replaced at Mayo Clinic because I have 5 metal allergies that were found out. And so the only place I could go was to a big place where they would have a knee that would fit me and wouldn't irritate my allergies, right. So I went there and I was supposed to go in at 11. I didn't go in till 3. So that told me why I was in the recovery room at 9 o'clock at night. And they were keeping me overnight. And I heard that nurse say, oh, I'm keeping her in recovery for another hour because her blood pressure's up. And then I must have gone back to sleep or something because I didn't notice any of that until, even I don't even have memory of when I was when they finally brought me to my room. But the next day, when I was more awake, I heard that one of the nurses say, well, PT won't take you because your blood pressure's up. Now, I was supposed to go home that day. So I was like, oh, boy, my blood pressure's up. We're going to send in the hospitalist, they said to me. I said, okay. And I'm saying to myself, and he's going to go look and see what they have me on that is shooting up my blood pressure. So the hospitalist comes in and I said to him, do me a favor, go look and see what medicines I'm on that is shooting up my blood pressure. And one of them was tramadol, and I forget what the other one was. But there were 2 medicines that were shooting up my blood pressure. So they did let me go home that day, thank God. But probably they wouldn't have if I hadn't been that forward and said to them, check and see what they have me on.
And I think that actually, a few points in here. It doesn't matter where you are. In this case, it was the Mayo Clinic.
Yeah, I know.
Yeah,
I
it's
thought
the
Mayo Clinic, I wouldn't run into this, but I did.
And these things happen when the concept of these academic centers from which we all come, because we all train in major academic centers. And then we expect that everybody there is going to be like, I don't know, we have them on a different level of status. No, it's like they're doctors, they're nurses, and they're prescribing the same drugs that we're prescribing. Granted, they have perhaps a little more rigorous process to hire people, but these things can happen anywhere. So don't think that nothing that they're infallible and that everything has to be okay because they're the one that are caring for you. The same thing that doesn't have to happen with a provider because he is the ultimate on that particular specialty. Doesn't mean that they know it all. No, so there's always room for learning something new. But the second point is also that you were okay saying, can you check what are they giving me? Because you knew your body. So when you know your body,
and
you're
I'm
like...
thankful that hospitalists listened, because with being a woman, sometimes they don't listen to you.
Yes.
But I was thankful that he came back and said to me, you're absolutely right.
Okay, beautiful. So then it takes you raising your voice, saying something, because otherwise you have taken that for a word, and then you probably have stayed there another 3 days as they're trying to figure out how to lower your blood pressure.
Right.
Also knowing your body, because you know that that's not a common problem for you, and then find somebody that can become a partner for you in that process. The hospitalist that was willing to listen, willing to do the due diligence, look into it, and then coming back and said, oh, yeah, we found something.
You're absolutely
so
right, yeah.
So I think that we had to speak up a little more, so sometimes we're afraid of how we're going to come across or how they're going to look at us, like we're bossing people around, or who do we think we are? But it doesn't have to be rude. Kindness, but you can actually still advocate for yourself, even with kindness. And if you are not being heard, then it's time to move on. Don't you agree?
And it was something I was out of it the day before with the anesthesia.
Otherwise, you'd be raising hell that day.
But
so you were semi-conscious.
They let me go home with the promise that when I got home, if my pressure was up, that I would take a chlorthalidone. I didn't need a chlorthalidone when I got home because my blood pressure was fine.
That's awesome.
So it's just that they,
Is there anything?
They didn't treat the whole patient.
Yes.
That's what my doctor said to me afterwards. At the time, the primary doctor that I had said, they just treat the condition and they don't treat the patient.
They were focusing in one aspect of it.
Yeah.
And forgot to look at the whole.
Yeah.
Do you want to share anything else with our female audience?
Just that let your doctor know if you have a problem. I have a cousin who, just like you were talking about it being a digestive issue, she swore it was her gallbladder. In the middle of the night, she ended up going on 466A, the emergency room there. They said to her, forget your gallbladder. We don't think there's anything wrong with your gallbladder, but you're going in to the hospital right now. We're taking you to the hospital. It was her heart.
So don't try to self-diagnose? Is that what you're trying to tell our woman? Don't try to self-diagnose. Just go and get checked.
Right.
And don't postpone.
Right.
I think that's a great one.
Yeah.
Don't self-diagnose.
When they rushed her to the hospital in Ocala, and they put a pacemaker in her.
Got it. So from a gallbladder to a pacemaker.
Yeah.
So you never know unless you know.
Right.
Yeah, so you got to make sure
she's on my father's side. Same thing.
Got
you
it.
know?
So we make sure that we keep protecting you, okay? Taking good care of you.
And you do.
I appreciate you, Joan. Thank you for being here today.
You're welcome.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.